Hello and welcome to the program. I'm Jeremy Fernandez. Coming up, how effective is the latest vaccine to hit Australian shores against the Delta strain? And are we a step closer to allowing more Australians to return home? We take a look at the new home quarantine pilot programs. But first, more than 70% of Australians over 16 have now received at least one dose of a coronavirus vaccine. New South Wales now has 50% of its population over 16 fully inoculated. Today, Victoria crossed over the 70% single-dose milestone, unlocking extra allowances for residents, including picnics from this weekend. For more on how these vaccination figures are affecting the ongoing outbreaks, here's Casey Briggs.
Well, Jeremy, along with these higher vaccination percentages, we're seeing a bending or a flattening of the curve, at least in New South Wales, that's consistent with what we would expect from the findings of the Doherty Institute model. Flat numbers of cases each day for the best part of a week. The 7-day average is dropping. The improvement concentrated still in just a few LGAs in Sydney largely. So one question is, will we start to see that dropping in numbers occurring across the entire city and the entire state? And the second question is, if this trend sticks, how much better will these numbers get in the next 3 weeks or so before New South Wales hits 70% double dose and significant restrictions ease, presumably affecting the transmission potential in Sydney? The sooner these numbers do really come down significantly, the sooner we can turn around this trend of deaths in New South Wales. 12 more deaths reported on Friday, 222 in this wave so far, and that trend line is still pointing upwards. But the effect of vaccines on the curve and on the seriousness of illness of the people that do get infected should hopefully turn that around in the coming weeks, at least we hope. In Victoria, well, the trend line is continuing to point up. It has been growing really quickly, the outbreak there. Maybe that growth is slowing down in just the last few days, and that would be a very welcome sign. About 510 cases found on Friday, and the number of people in hospital in Victoria is also growing, and it is growing relatively quickly at the moment. 208 people in hospital, 49 in intensive care, 32 on ventilators as of Friday. And in the ACT, well, that outbreak there in the ACT has been remarkably steady for a very long time. Do we now need to be a bit concerned that this might be beginning to worsen? 30 cases on Friday, so that is up there with some of the worst days in this pandemic. Could be a blip, absolutely could be a blip, but the number of cases that have had exposure in the community has started to trend up again in the last few days, and it's approaching the worst it's been through this outbreak. So a bit to watch there in the ACT, which has kept a lid on things for a long time. Will that continue, Jeremy, to be the case?
Casey, thank you. Well, New South Wales will begin a 7-day home quarantine trial that's being described as an important step towards living with COVID. A mobile phone app using location and facial recognition technology will form part of the trial that will involve 175 fully vaccinated people.
We can't stay closed forever. We've got to be able to learn what happens when we put people into home-based quarantine. That's what this step will do. Australia must reopen. We must get rid of lockdowns. We must get rid of home quarantine. We must re-engage with the world. Sydney is a global city and it must engage with the globe. This is an important step in that direction.
The South Australian government has also announced that it will expand its home quarantine trial, while Tasmania will begin a trial for residents returning home from regional New South Wales. Dr. Norman Swan joins us now. Dr. Swan, what do we know about the relative risk in the community in places where home quarantine is being trialled or expanded?
Well, there are various variables. One is, should the worst happen and a virus escapes, what would it do in the community, assuming it's the same variant that's in the community? So if you've got a lot of virus that's out there in the community already, and you have a very high rate of immunisation, and New South Wales is going really well, and Victoria is not far behind, as Casey was saying, and you were saying in your introduction, then the harm that it can do is not as great, although you've probably got to get to 90% vaccination rates of 16 and above, or ideally 12 and above, to actually get to that point of protection. And there are some suburbs in Sydney which are already at 90% single vax, which means there'll be a double vax before too long, at 90%, which is an amazing result. And you've just got to get 12 to 15-year-olds to come along there. Second thing is, well, how are you managing the risk of people coming in from overseas? Are they PCR negative maybe 2 or 3 days before they leave? Maybe you would do rapid antigen testing a couple of times before they arrive, just before they get on the plane, maybe just when they get off the plane. So you're minimizing the chance they're not infectious. I don't know whether they're going to do that or not. And then the app to ensure that they don't leave where they say they are. And 7 days is just a little bit more than one cycle of the virus. So there is some risk in that. The question is, if you're fully vaccinated, what is the real risk? There's at least a 50% reduction in transmission risk or infection risk if you're fully vaccinated, probably a reduced chance of passing it on. Those are controversial figures at the moment. It looks possible from New South Wales data that it's even better than that. So the risk may well be quite low.
Another factor is that the only people allowed to participate in these trials are ones who've had a vaccine that's recognised by the TGA in Australia. Do you see longer term that we'll have to accept people who have had a different vaccine, say Sinovac, for instance?
That may be the case. To get international recognition, to get international uniformity, you may have to accept what WHO has accepted as approved vaccines, and Sinovac would, I think, be one of those. Sinovac is not as effective from the current data as the other vaccines, but you may well have to do that to get international recognition here. But international uniformity, I should say, of a vaccine passport. But there are only a few vaccines on the market. You certainly wouldn't do it if it was Sputnik. You just don't know what's going on with Sputnik. But Sinovac, we've got some kind of fix on how effective it is, but it's at the low end of effectiveness.
Let's turn to Victoria, where case numbers are surging and we're seeing more mystery unleaked cases each day. What's your assessment of how things are going in Melbourne and where they're headed in the medium to long term?
Well, Melbourne's doing very well on vaccination, but it's still not well enough to really bend the curve in its own right. Melburnians are really under serious lockdown, but mobility rates are higher than previous outbreaks. It's very hard to maintain that. And it's really lockdown that's going to help there. They will turn around. As Casey said, the figures are starting to show some little signs of improvement. But you've got a lag in hospitalizations, which is going to hit hard on the Victorian hospital system. It's just too early to say.
What about in New South Wales? Case numbers are still relatively high, but for the first time in a long time, they're not climbing so steeply. Is it too early to call that a flattening of the curve?
It might be. And the reason I say it might be too early is that it's circled back into communities outside the 12 LGAs. And if it spreads, so it's circled back to the city of Sydney, eastern suburbs, and it could circle back to other parts of Sydney. And if it does that into areas where the lockdown hasn't been as severe, you could get spread. And some of those areas are not very well vaccinated. So there is quite a lot of risk in New South Wales. Most of the flattening of the curve has occurred in the 12 LGAs and the good people of those LGAs who've really been under serious lockdown for a long time.
Dr. Norman Swan, good to talk to you. Thank you.
You're welcome, Jeremy.
Professor Christine McCartney is the Director of the National Centre for Immunisation Research and Surveillance. She specialises in infectious diseases and vaccinology. She joins us now. Professor, we have 3 vaccines now approved in Australia. How does their effectiveness stack up against each other?
Look, extraordinarily well. And I think we're seeing very high vaccine effectiveness against severe disease, against being hospitalised. And that's across the board for Pfizer, one of the mRNA vaccines, for Moderna, the second mRNA vaccine that's just starting to be rolled out, and for AstraZeneca. And there's new data coming out now that's also talking about the duration of that effectiveness. And again, stacking up very well against severe disease. Now, coming back to the fact that there are some people that are, thinking, well, I'll take my chance. I'm not going to get the vaccine. I don't want to put something into my body. Jeremy, it's so heartbreaking to see those people then in the ICU and having regretted the decision that they've made. And that's what, my fellow clinicians, infectious disease specialists are seeing across, parts of Australia now is sadly people who are saying, I just wish I'd went and got the vaccine. it does work. It works extremely well, and the data is holding up on that, with obviously policy adjustments around boosters and things, in time to come.
While most of the world remains unvaccinated, how great is the risk of a new variant of concern emerging, particularly one that can beat the vaccines we've already got?
So that risk of a new variant emerging is ever present. It just, Delta has been a pandemic game changer. It's been really difficult to live through the additional challenges of the Delta variant, but another variant could emerge. And this is why it is so critical. Another variant of this severity could emerge, and transmissibility. That's why it's so critical that we use our vaccine supply across the whole globe. Variants emerge when there is a whole ton of virus transmission in hundreds of thousands of people, and that just allows the virus to just adapt until it gets even more fit and, either more severe, more easily spread, or evading the immune response from vaccination. So if we have parts of the world where there is still great virus transmission, we will see those parts of the world lead to the production of new variants, which puts us at risk in the whole world. It's why we need this sparse resource of vaccines to go ever more now and very quickly to parts of the world where vaccination rates are not high.
Let's talk about long COVID. How effective are vaccines at reducing instances of long COVID?
It's a great question. So most of the studies have been aimed at looking at, hospitalisation and, severe disease or any infection, or even some studies on transmission. There haven't been formal studies that have looked at long COVID in terms of measuring the effectiveness of the vaccines. But I'm very optimistic that vaccines will protect against long COVID. And the reasons are because, firstly, if you're vaccinated and you don't get COVID at all, well, you're not going to get long COVID. If you're vaccinated and you have a milder case, a milder infection, then we know that long COVID is more common if you have a severe illness. If you've been in the ICU for many weeks, you have all of the debilitating, symptoms after that take quite a long time to get over. So if we can prevent severe COVID, we will reduce the likelihood of having long COVID. And it's yet another, important reason to be vaccinated. The studies of long COVID will become more and more rigorous over time, but they are quite challenging to do, and you need a long time to do them because it is long COVID.
Now, you're a paediatric specialist. Are you concerned about the relative risk to children as we start to open up?
Oh, look, children will be infected with COVID. We know anyone of any age can be infected with COVID, but children tend to have milder disease. It's been consistent throughout the pandemic, including with the Delta strain. Now, with Delta, we see a lot more infections. We are seeing more hospitalisations in children, but it's still, compared to the total number of children infected, only around 2% or less who will be hospitalised. Many who are hospitalised have underlying medical conditions, so it's really important, again, for those children to be vaccinated first and foremost. But we've now got programs for 12 years plus. We know that kids want to get back into the world again. They want to get back to school. We will see information coming from the clinical trials in 5 to 11-year-olds, I expect within a few weeks for Pfizer, and then probably soon after for Moderna. And I think that will be another era of, potentially opening up vaccines. But I would really encourage parents where the opportunity is arising for them to return their child to school to do so with confidence in the setting where they themselves are vaccinated. They must be vaccinated. It is the adults here who are a risk to the children, not the other way around. The staff, we want all of them to be vaccinated in school, childcare, wherever we are, to have that important face-to-face return to learning for kids of all ages.
Professor McCartney, so good to talk to you. Thanks so much.
You're very welcome, Jeremy.
And that is the show for this week. You can catch up anytime on ABC iView. Thanks for your company. From all of us, stay safe. Bye for now.